Welcome to TRICO. I'm Falguni Wheadon, welcoming you to TRICO's 15th edition. Welcome to TRICO. I'm Falguni Wheadon, and I'm delighted to introduce you to Dr. Kintur Sanghvi for our 15th edition of TRICO.
Thank you.
Dr. Sanghvi, perhaps you can introduce yourself.
Sure. My name is Kintur Sanghvi. I'm an interventional cardiologist. I practice at Deborah Heart and Lung Center, which is located in central New Jersey in U.S.A. I have been practicing interventional cardiology for over 11 years and do all sorts of interventions, including coronary interventions, peripheral interventions, and structural interventions. I am also a product of Ahmedabad. My mentor is Dr. Patel, and this is home. So I'm here for the TRICO conference, which has been an exciting first day and the beginning session. And we are here in between the TRICO breakouts.
Thank you so much. As you said, it's been such an exciting morning for us already. What are your thoughts on some of the live complex cases that you've seen so far?
So, this I think is one of the best live conferences in the world, particularly for the transradial approach. In this morning, today, we saw 3 cases. The first one was a 2 bifurcation LED diagonal, another was the left main bifurcation in the same patient, in a typical Indian patient of a small radial artery where a 7 French guide was used efficiently, and a very evidence-based provisional stent technique with OCT guidance was performed on the LAD and left main, followed by a chronic total occlusion, which was performed by Dr. Saito, who is legend in this field of CTO intervention. Again, very good teaching points of what kind of wire to be used and what are the selection criteria. Followed by, there was the third case, which was a robotic PCI. And again, it was showed very efficiently where the technology is heading, where the technology is going to improve the patient outcome as well as physicians' working conditions.
Thank you. And any messaging for some of those young cardiologists who have been lucky enough to join us here today or perhaps are watching online?
So the message is that, this conference is really there for all these young cardiologists, because you have some of the world's best experts in different fields. So you have CTO operators like Dr. Saito and Dr. Gantham. You have radialists like Takwan and Rajiv Gulati from Mayo. Of course, Dr. Tejas Patel is the director, but you have Sam Pancholi, who has done so much work and understood the transradial approach in and out. So this is the place where you are going to go through simple starting steps and how to progress through your career. What are the do's and don'ts when you go back to your cath lab. This is the course where what happens. Even being here for 15 years from the inception of this course, almost every year except 2, I can tell you that every year I walk out of here with at least 3 or 4, maybe sometimes 10 new techniques that I can bring home to my lab and implement that to improve my patient's outcome or improve my procedural outcome. So very important thing is you pay attention to all the details and important explanations that are given along with the live case presentations. You should definitely pay attention to the discussion that will really translate into your thinking pattern, because that's what it is very important. When you are taking care of a patient in a cath lab and you're doing a complex intervention, it's very important that you think through all the possible alternates and options and select the right one based on the discussions that you are seeing in the live conference with multiple faculties from India as well as international faculties.
Thank you. As we touched on, precision is really at the forefront of technology today. OCT, Apex Heart Institute, is the Centre of Excellence for Southeast Asia. How do you think OCT can really push technology can push healthcare forward?
So OCT in particular gives a very, very high definition images of the coronary arteries and the implants that we do for the coronary stents, or it also gives a very good understanding of the morphology of the lesion. This technology tells us a lot. Very important. Today in the live case, Dr. Patel explained that you have to use the technology keeping the patient as a whole into consideration. So you look at the whole patient and then a particular clinical problem, and not just get lost in the small details of the imaging. But this detailed imaging can provide you to precisely use your tools to make sure your patient's artery, the disease that you have opened up, stays open for a long time. So there's more and more evidence mounting that the image-guided stenting has significant reduction of the something we call target lesion revascularization. So the stent failure, this is a common question patient asks, that how much longer this stent is going to last. There is a percentage probability of a stent getting a blockage inside the stent or getting a blood clot inside the stent. And that percentage probability can be significantly reduced by image guidance like OCT. So it is playing an important role in coronary interventions in today's time, and then going forward it's only going to increase as the use of this technology becomes more universal and people are becoming more and more familiar using it.
And I'd like to touch briefly now on robotics. It's obviously the word on everybody's lips at the moment. So the Apex Heart Institute has performed over 500 procedures in the last 2 years, which is the most globally. More recently, we saw the first 5 cases of telerobotics being performed, which was subsequently published in The Lancet. Fantastic, of course. What are your views on that technology? Can it really help our patients of today, telerobotics?
So, first of all, about the telerobotics and the first 5 cases, that's a very commendable work, because somebody somewhere had to start, and of course it had to, start with some efficient operators and efficient team which can work together and show that this is possible. And I am really very proud that this was done in India, where that was my motherland. So I'm very happy that this big step was taken right here at Apex Heart Institute. As far as the robotic technique, it is, in my opinion, it's not ready for prime time. It's not ready for every case. It's very good for coronary interventions right now, but in the United States, our practice includes about 50% of the work in the coronary space, while other 50% is either in structural heart procedures. So we do transcatheter aortic valve replacement or left atrial appendage occlusion or similar procedures, or we do a lot of peripheral interventions where we work in the leg arteries or in the brain artery. And for those things, this technology is not ready yet. It is focused a little bit on the neuro interventions, which is where I think the technology can really play a big role in advancing the care. Similarly, coronary intervention also is a place where there is a future. And I think this is the right place to kind of advance this technology as the experience mounts and what are the corrections needed. So I'm really commending Dr. Patel's team as he led the radial evolution for the entire globe. Similarly, he, along with some of the other thought leaders in the field, are leading this evolution of using technology and improving precision of interventions that we do, and also reducing physicians' radiation exposure, physicians' exposure to the wearing a lot of lead for longer hours, which then translates. So if you see around, and if you see the data, interventional cardiologists or interventional radiologists have high risk of left-sided brain cancer. Similarly, they have very high risk of having spine and joint disease. You see commonly experienced interventionalists are walking like their posture has changed. So those are the places this technology will help a lot. And I think now we have to look forward to the evolution of the technology.
Yeah, agreed. And just finally, before we let you get back to TRICO and the live procedures, Dr. Patel, he was your mentor.
Absolutely.
As you were coming through the ranks. He remains your mentor.
Yes, still.
Where would you like to see him go next?
I think he's doing an incredible job of not just taking care of thousands of patients, including my mother, but he does incredible job of forwarding a particular treatment segment. So there is a lot of original work that he has done in advancing this very patient-friendly, truly minimally invasive, truly economic approach of transradial approach. You know, where we are today is because of hand-counted 3 or 4 thought leaders like Dr. Patel in the entire world who advanced this transradial approach to where it is right now. And it has saved countless lives because so many patients has, you know, been prevented, and his teaching has spread all over the world. All over the world, I come across cardiologists who have read his atlas or they have seen his videos, and you know that has helped them improve their patients' care. So one person can touch so many lives. Is just a perfect example. I hope he continues to do the same. Right now, he's focused on the OCT as well as robotics coronary intervention. I hope that similarly he picks the next segment where he can further improvise what we are doing today and help other thought leaders in the world and the industry to get into the right path.
Dr. Kintur Sanghvi, thank you so much for joining us at TRICO's 15th edition.
Thank you very much. It's my pleasure to be here.
Thank you.